Hey everyone, this is Reese with Health Cares. Today I'm going to walk you through how to use Health Sherpa. You can find the link below in the description, as well as in the pinned comment, of course on my website, and even in the description of the channel. That's going to take you to the most easy to use resource to enroll in an ACA plan through the public marketplace. You can also do this with healthcare.gov, just a little bit more user friendly, but all of the information will still apply. So come with me. We're going to check out these different options, how to enroll, what's involved in the application together, and walk you through each thing step by step. So the first thing we're going to do is in the description of the video, as well as the pinned comment, you'll see a link to see if you qualify for free health plans through the public marketplace. You can just click on that link. It'll take you to Health Sherpa. This is a lot more user-friendly than using healthcare.gov, but the information remains the same. Now, if you have an account, you can always sign in, but in case you're a new user, just go ahead and put your zip code. The name, email, and phone number, of course, are optional, as you can see. And now you can get started. It's pretty straightforward. It's going to ask you for your age. So we're going to put 31 male. It'll ask if you're a tobacco user or if you're eligible for other coverage. So it's really important to keep in mind that if your job offers coverage, even if you choose not to take it, you still have to check this box. So that's something that you got to keep in mind. If you are a female, of course, they do give you the additional option of checking if you are currently pregnant, seeing as how you are not able to be denied for health insurance services due to pregnancy on the public marketplace. So we're just going to check it back to male. Now, if you have a spouse or if you have dependents, you can add them in at this time as well. It's super straightforward. We're going to leave it blank for the time being, just so we can go through a couple different options. Next thing it's going to ask is about your taxable household size and income. Now, if you have a dependent living with you, you have to consider their income if they're working in that household income. In this particular example, we're going to do a household of one to keep things as easy as possible, but you also have to keep in mind that your annual household income for taxes will determine whether or not you're eligible for a discount through the marketplace, otherwise known as a subsidy. So we'll call it $30,000 a year. That person will likely get a subsidy, but at $300,000 a year, they certainly would not. We'll put it at 30,000 for now, just so you can kind of take a look at a few different options and how that savings will affect your coverage options. At 30,000 a year, you can see we get a pretty big amount of savings, $367 a month. So you also are going to get this cost sharing reduction. Now, this is super important because the cost sharing reduction will apply to silver level plans specifically, and it is going to give you cheaper doctor's visits, cheaper hospital visits, cheaper prescriptions, lower deductibles, lower out-of-pocket max. You're going to have a hard time beating the coverage that you can get on a CSR level plan, even through an employer. As unfortunate as it is, the only way you're going to have access to that is going to be if you do have a low enough income to fit within their threshold. Now, right now, it's not open enrollment, so you would have to have a special enrollment or qualifying life event. So that's going to cover a few different things. We've got, of course, a loss or change of health coverage, change in household size, change in primary place of living, change in eligibility, enrollment plan errors, offered an individual coverage HRA or something similar like a Q-Shara. And of course, there's other different situations or even none of the above. Now, if you check none of the above, it's not going to allow you to enroll in health coverage at this time since it is outside of open enrollment. So we can look at a couple different plans. We're going to go ahead and check that we lost other coverage. Otherwise, it's not going to let us onto the next page. If you have specific doctors that you want to keep in network, or at least see if they're going to be in network, you can put them in at this time. We're going to go ahead and skip that. And of course, the same thing for your medications. So if you take something like metformin or any generic medications, they're going to be pretty simple. But when it comes to those brand names, those specialty medications, you definitely want to double, triple check because that can get incredibly expensive if you don't have the right coverage for it. We're going to skip putting in the email address for now, but if you do put in that email address, you'll be able to track your progress, pick up where you left off. It'll make things a lot easier for you. Now you can see with that cost sharing reduction, we have options as low as $0 a month with Oscar, Ambetter. There's tons of different carriers available, which will all be listed off to the side here. Aetna, Ambetter, AvMed, Florida Blue, so on and so forth. You can see that you do get major brand names like your United Healthcares, your Blue Crosses, your Aetnas, and you also get those other carriers as well that you may be less familiar with, such as your Ambetters, your AvMeds, your Oscars, Molinas, so on and so forth. One thing I really want to point out, the carrier itself isn't as important as some people seem to think. What is more important is making sure that your doctor is in network, because if your doctor is not in network, it doesn't matter if you have Blue Cross or United Healthcare, because that's not going to make a difference. Um, Being in network is going to make a huge difference on if you can see that doctor at all, as well as how much you're going to pay at the time of that doctor's visit, because they get an in network reduced rate. You also have all of your insurance benefits being applied. There's a lot that goes into it. So staying in network is very important. Other things, of course, there's your deductible. Now, that's going to be the annual amount that you're typically responsible for before insurance is going to kick in 100%. There's obviously different things that you got to keep in mind. Your preventative care is going to be free 100% through the public marketplace. If you have a copay, which is a set dollar amount you pay for a particular service, then you're going to be paying that copay $70 for a primary care doctor in this case, $125 for a specialist. Generic medications like $3. Now, where you see this full price, that's when you're paying 100% of that cost towards your deductible. You always want to make sure that whatever services you typically use, you look at the benefits, because if you're someone who's frequently getting blood work done, if you don't have a copay, that's going to add up very, very quickly. You want to make sure that you speak with a licensed agent who actually cares about making sure to put you in the proper position, because otherwise you just pick the cheapest possible thing and it may not be the right fit for you. Now we're going to take a look at those CSR plans next so we can compare the difference between that CSR and something like a bronze level plan. For that, so like here is a couple Ambetters with a CSR. You can see there's tons of different things available. So let's just check any of these. And we'll hit the compare to plans. We've got Ambetter, we've got Oscar. With that discount, it's obviously making a huge impact. So that's something that you want to keep in mind. The deductibles are very similar, about 46, 4,700. The max out of pocket is where you do see the biggest difference. Now, the maximum out of pocket, that's the most you'll ever spend within a single year on those health insurance related costs. So your annual deductible is factored into that max out of pocket, but your monthly premiums do not go towards that max amount of pocket. That's only going to be medical services, whether that be doctor's visits or procedures, whatever the case may be there. So definitely something that you want to keep in mind. Overall rating, you always want to take ratings with a grain of salt, especially with health insurance. And here's the main reason why. If you go to any health insurance company and you look up their ratings and their reviews, you're only going to find negative reviews. The main reason for that is if you go to a doctor, you get a colonoscopy done, the best case scenario, you're going to leave a review for the doctor's office. You're not likely to leave a review for your insurance unless something goes wrong, whether it may not have been covered, or you may be unhappy for some reason, or maybe the insurance didn't do anything at all and it's just the doctor's office that's causing problems for you. Whatever the case may be there, you always want to take that with a grain of salt, because I've never once heard of somebody who went to a doctor's office and then left their insurance a positive review about how well it worked. You just be realistic about it. Network types we've discussed in another video, so I'm not going to get too much into that now, but you can see that there's definitely a really useful tools with comparing and contrasting your different insurances that are available to you. What's most important though is working with a licensed agent to find what fits the best for your individual needs and your situation. Let's say that you didn't have that reduced rate based off of income, whether you're just a higher income earner or you're offered coverage through an employer, whatever the case may be there. So you can see the full price of these plans, you lose that CSR. So you're looking at your typical, what anybody else would see health insurance plans through the public marketplace. So about $350 per person on the monthly premium for somebody who's about 30 years old. That's a rough average. Those deductibles are pretty high. So for somebody choosing one of these health plans, they should be someone who's not frequently going to the doctor, whose main concern is their annual exams, and so on and so forth. Now, there is a $0 deductible option here with Aetna. That's awesome. I'm going to take a look at that real quick. So you got no deductible, $9,400 maximum out of pocket. Primary care is reasonable. Specialist is reasonable. $100 isn't too bad. Generic medications, that's really high for some generic medications. So if you don't use it, I suggest checking out something like GoodRx, because you can definitely get generic medications for less than $40. Let's see. X-rays and imaging. This is actually a pretty good plan. You have a set copay for pretty much everything that you can think of. Physical rehab, it's only $80. Outpatient mental health is only $15. I mean, even if you had a baby on this plan, it's only a $2,500 copay. So this is actually really good for low to medium usage individual, only at $381.99. So that's pretty darn good. So let's say this is the plan we want to go with. We're just going to hit add to cart. It's going to say, do you want to shop for a dental plan? We'll look at dental plans in another video. So we'll just go ahead and start the application. And it's going to go through your privacy statements. It's going to have this nice long disclaimer. I definitely suggest reading through it at least a little bit. And then you'll hit your agree and I understand. Applicant signature, that'll be your own name. And then you just start rolling into the application. Now it is going to ask, of course, your social security number. It is going to ask about your income information. If you are getting a plan based off of your income, it's incredibly important to make sure this is as accurate as it possibly can be. It is highly recommended that you work with an agent if you have any questions whatsoever. They do have plenty of ways you can get support. You can contact me. My number will be right there on the side. If you have a question about whether or not your doctor's going to be in network, we can always look that up. But making sure this is filled out properly is going to be incredibly important. Now, some people may have the idea in their head that, oh, well, if I just say that I make $30,000 a year, then I'll get a lower rate on my health insurance. Definitely don't do that. And the main reason why is because at the end of the year, you're going to get issued a 1095-A, and that's going to say how much of a subsidy you received. So when you file that with your taxes, they're going to process everything through the IRS. And if it turns out that you misrepresented your income, then you'll have to pay back the difference and possibly even pay an additional penalty. This is why it's incredibly important to work with someone who's licensed in your specific state. If you have any additional questions, you can always reach out to us. Our website, of course, will be on the Health Sherpa at the bottom left, or you can go to healththatcares.net for additional information about the services we offer, the information that we provide, and of course, everything that we do. Hope you have a wonderful day, and feel free to reach out with any additional questions.